Virginia CRNAs are the last face the patient sees before they go to sleep, and they're the first face they see when they wake up. We want our patients to know that we are there for them every heartbeat, every breath, every second that their anesthesia care is happening. The Virginia Code has the word supervision for CRNAs. It is not defined in the code. The word consultation is defined as an exchange of information about patients. Whether CRNAs are working independently with a surgeon or with a physician anesthesiologist, the word consultation is the correct word.
So by allowing CRNAs to practice independently, it opens up access to care, especially in rural areas where there are not physician anesthesiologists at those practices, to be able to provide quality anesthesia services to patients of all kinds.
Having CRNAs in rural areas allows patients that need care to stay close to home. So they have their support systems there, they have their loved ones, they have their caregivers that are going to take care of them when they go home, so that the patients don't have to travel hours away.
It is extremely helpful to have CRNAs in places where healthcare is hard to access, because we're not just in the operating room.
If I go to the rural area where there might be one main hospital and there is a significant reduction in physician anesthesiologists there, CRNAs throughout history have always stepped up and have been available in those rural areas.
Full practice authority for CRNAs would be most beneficial for underserved populations and patients that are in rural areas that do not have access to tertiary care centers immediately.
As far as access to care is concerned, there are areas in the state of Virginia that don't have the capability of having anesthesiologists.
And then when I look at the patient population we have and the access to care, and to know that we have enough CRNAs that can practice and will practice independently, it's unfortunate that they do not have the ability to practice in that realm based on what we currently have dictated in the state of Virginia.
All facilities do not have the same requirement. Some facilities will have a 1-to-1 requirement or a 1-to-2 requirement. Just imagine if you did that in everyday life, if you had to have somebody supervise 1-to-2, and the duplication of effort that you have, not just for the comfort of the patient, but for the financial responsibilities to the facility.
So having CRNAs practice to the full scope of their education would definitely increase patients' access to care. It would increase the amount of operating rooms that could operate simultaneously. It would decrease the gaps, and it would decrease the wait times for patients receiving surgery, receiving the care that they need. It would increase patient flow through the operating room. It would decrease the amount of time a patient might be in pain.
Right now we have patients who are waiting extensive lengths of time for having a procedure done. One of the easy fixes for that would be that we actually use all of our providers to our full scope of practice and practice in such a way that everybody's doing cases, and you remove the barriers that exist with having supervision.
There's been numerous studies published by objective organizations and objective groups, and all that literature supports that nurse anesthetists are very safe, and just as safe as any other anesthesia provider in providing care to those patients.
In one incident, there was no physician anesthesiologist around, and we had an emergency situation where the mom and the baby were in danger, and we needed to do an emergency C-section. So the surgeon was uncomfortable with me going back to do the anesthesia, because he kind of assumed that since there was supervision requirement that he would be liable for my actions, which technically isn't true, but there's a perception that it is. So he was more inclined to want to wait until the anesthesiologist got there, which kind of wasted time or valuable time, and put the mom and the baby in more danger. Fortunately, we had a good outcome, but really in that instance, supervision just sort of undermined what we were trying to accomplish, and that is provide the best quality care and safety we can for that mom and that baby.
So if we took away the supervision role and let physician anesthesiologists and nurse anesthetists do their job, then there would be enough care and coverage to go around. Virginia CRNAs will continue to deliver expert anesthesia care and continue to keep their patients safe.
We are anesthesia experts. We are CRNAs.